1 out of 4 Americans is directly affected by a mental health condition or addiction. That means you or someone you love has a diagnosable and treatable condition like anxiety, depression, or an eating disorder. Maybe you know someone seeking help for an addiction to alcohol or opiates. Mental health affects all of us. And like many, you probably rely on private insurance for your health care, including your mental health care. Getting the treatment for your condition can be difficult. It's not because you don't want to find a doctor and be treated. It's because when you do, insurance companies often deny your claims and leave you wondering why. It can be a mysterious and frustrating process for some, and even life-threatening for others. Has this happened to you or someone you know? You're not alone. It's happened to countless people from all over the country for many, many years, and it's time to put it to an end. You have rights under something called the Parity Law, and I'm here to tell you what you can do right now to protect yourself and get the care you need. But first, what is parity? It's important to understand because parity is your right. Let's take a step back for a second. Let's imagine that you had diabetes or heart disease. Your doctor would know exactly how to treat you, and your insurance company would know how to cover those services. They're in the business of healthcare after all, and to them, treating your illness now will save them money down the road. It's called prevention. What we do for physical health, we rarely do for brain health. It's hard to understand why. And as a result, insurance companies routinely deny coverage for mental health conditions and addictions, treating the brain as if it's not really part of the body. And for a long time, they've gotten away with it. But under the Parity Law, they shouldn't. In fact, if they don't offer mental health and addiction services at the same level as other medical benefits, insurance companies are breaking the law. Parity is just a fancy way of saying fairness and equality. Your mental health care should be on par with your physical health care. No higher copays, no higher out-of-pocket costs, no unfair treatment limitations, period. What's good enough for the body should be good enough for the brain. And those denials of care I mentioned, well, they're probably a violation of parity, a law that's almost a decade old. So why am I telling you this? I wrote the law when I was in Congress because I saw what I still see now, big problems, shattered lives, and a fundamentally unfair system. In fact, I believe that access to mental health and addiction care is a civil right and something we need to protect and defend. If parity is indeed a right, then what does it mean for you? If you receive one of those denial letters, I'll bet you've asked yourself what you can do. For a long time, the answer was not much, unless you were willing to enter a bureaucratic maze that few actually came out of. Or you might try to hire a lawyer, but many of us don't have the time or money for that. But now there's a way to appeal a health plan decision. Those denials are not the last word. That's why I want to take a minute to walk you through this appeals process in the hopes that you'll use this information to get the care you are entitled to. Step 1, visit parityregistry.org, and there you'll find information on how to file an appeal and join our new complaints registry so we can work together to put an end to those denials. We need to show the insurance companies that we mean business. We can only do this if we have you and your friends and family members on board. Second, log your complaint in our system. We'll use it to show how many people are in the same position as you. We need to hear your voice and your story. That's how change happens. Third, use the website's resources to educate yourself on the appeals process. We won't be able to file the appeal for you, but in 10 minutes you'll be able to learn how to do it for yourself. That power is in your hands. Fourth, exercise your rights. Share this tool with others and make your voice heard. Access to mental health and addiction care is your right, and protecting that right is part of our common struggle. We are all in this together, and I hope you will join me in taking on the unfair and illegal practices of the insurance industry. If you have questions, be sure to visit parityregistry.org and send us an email. Thank you.